A 72-year-old woman walked into my clinic one morning shaking in the hands, her face flushed and worried. She had been sitting quietly, reading a letter, when her blood pressure suddenly jumped. She felt dizzy and frightened. We tried a few simple checks, and then I asked her to do something she could do right where she sat, a short, gentle hand stretch. 20 seconds later, she breathed more easily. Her shoulders eased. Her pulse felt less frantic. That small, deliberate movement didn't replace her medications or her follow-up plan, but it gave her immediate calm, and, over weeks, she reported sleeping better and thinking more clearly on the days she used it. If you are over 60 and want a simple, daily habit that helps your brain get steady blood flow and a calmer nervous system, this is for you. I'm Dr. Howard Tucker. I've worked with older adults for decades, and I've seen how tiny habits can change daily comfort and mental clarity. I also lean on the wisdom of senior clinicians like Dr. Shigeaki Hinohara, who believed in practical routines that anyone could do. What I'm going to show you is short, safe for most people, and focused on brain health, not as a cure, but as a supportive routine that may help your circulation and calm your nervous system. If you want short, research-informed habits for seniors, tap subscribe and stay with me for a minute. Here's why your hands matter for your brain. The palm of your hand is not just soft skin and bones. It's full of tiny blood vessels, a dense web of capillaries, and a lot of sensory receptors. Those receptors, sometimes called mechanoreceptors, sense stretch and pressure. They send signals up nerves in your arm, especially the median and ulnar nerves, and those signals reach the brainstem, the part of the brain that helps control automatic functions like heart rate and blood vessel tone. When the hand sends a calming signal, the brainstem can nudge the body toward rest, heartbeat steadier, blood vessels a touch more relaxed, breathing smoother. There's also a chemical side to this. Gentle stretching and touch can encourage the release of nitric oxide, a tiny gas our bodies make that helps blood vessels open a little wider. Open vessels mean better microcirculation, blood reaching small vessels under the skin, and, importantly, small branches that support the brain. Combined with a nervous system reset toward the parasympathetic side, the rest and digest response, these changes can improve brain perfusion and calm the mind. That's the link to brain health: steadier blood flow, less nervous system noise, better sleep, and clearer thinking. Let me explain that 3 ways so it's easy to remember. First, neuro reset. The hand sensors talk to your brainstem and can turn up the body's relaxation response. Second, vascular effect. Nitric oxide and microcirculatory unloading let small vessels carry blood more easily. Third, mechanical chain. When the palm and fingers relax, shoulders relax too. That reduces tension that otherwise interferes with circulation. Together, these are small shifts that add up when repeated daily. Now, I'll guide you through the exact hand stretch I use with patients. Use a comfortable chair. Keep your elbows soft, not locked. Breathe quietly and steadily. If at any point you feel pain, severe numbness, chest pain, faintness, or worsening symptoms, stop and seek medical help. This routine is gentle, but it is not for sudden emergencies. Begin with your right arm. Extend it forward at a comfortable angle. Keep the elbow slightly bent, think soft, not stiff. Face your palm toward me as if signaling stop. Spread your fingers wide as if you're showing the palm of your hand. Hold that open palm gently for 5 seconds. Count slowly in your head. 1, 2, 3, 4, 5. Breathe out as you hold the stretch. Notice any warmth or mild tingling in the palm or forearm. That's the body responding. Next, use your left hand, your opposite hand, to gently pull the fingers of the right hand back, bending them toward your wrist. Don't force the stretch. The pull should feel easy and comfortable. Hold that gentle backward pull for 3 seconds. 1, 2, 3, and breathe out as you pull. Then let go and make a loose, relaxed fist with the right hand. Close the fingers softly around the thumb, not gripping tightly, just forming a loose fist. Hold that loose fist for 3 seconds. 1, 2, and then open the palm again into a wide stop position. That sequence, open palm 5 seconds, gentle finger pull 3 seconds, loose fist 3 seconds, open palm, counts as one cycle. Repeat this cycle 6 to 8 times for the right hand. Move slowly. If you prefer, aim for 6 cycles the first week and build up to 8 as it feels comfortable. The whole process should take about 1 minute per hand. After you finish the right hand, switch and do the exact same sequence with the left hand. A few things to watch for while you do this. Exhale when you stretch. Avoid holding your breath. Keep the elbow soft. Locking the elbow can create tension that we don't want. Don't squeeze or pull hard. Include the thumb in the stretch. Many people forget the thumb, but it has a large area of nerve and blood supply, and it matters. Move deliberately. Slow is the secret here. Rushing reduces the nervous system benefit. Listen to what your body tells you during the stretch. You may feel a mild warming sensation in the palm or forearm when circulation improves. You may notice your shoulders drop a little or your jaw unclench. These are good signs. If you feel sharp pain, intense numbness, worsening tingling, sudden dizziness, or chest discomfort, stop immediately and get medical help. This routine is meant to calm and support, not to push through pain. For rhythm, here's a simple verbal cue set you can use as you practice at home. Open, 5, breathe out. Pull back, 3, breathe out. Loose fist, 3, relax. Repeat. Say it quietly to yourself as you move. This helps keep the pace slow and steady. When should you do this? I recommend 3 brief windows during the day. First, in the morning, while still in bed or sitting on the side of the bed, before you stand up. Doing it before the first big movement helps start your day with steadier circulation and a calmer system. Second, in the late afternoon. That's a common time when blood pressure and fatigue can peak. A 1-minute hand routine then can reset your nervous system and give a gentle boost to circulation. Third, in the evening before you go to sleep. A final palm stretch can quiet the system and help your body settle into sleep more easily. Together, these 3 windows mean about 4 minutes total daily, a small time investment for a possible daily benefit. Consistency matters more than intensity. Doing this routine daily, most days of the week, is where you'll see the effect. Many seniors tell me they notice immediate small changes. Less short-term anxiety, a lighter chest, smoother breathing, and with a few weeks of regular practice, they sleep better or think more clearly at certain times of the day. Keep a simple habit cue. Do it after you brush your teeth in the morning, after your afternoon tea, and before you turn off the bedroom light at night. Tiny routines are easier to keep when they attach to something you already do. Now, let me address common mistakes and how to fix them. First mistake, squeezing too hard. Some people assume stronger equals better. Not here. Gentle is better. If you squeeze, you compress blood vessels and reduce the benefit. Second mistake, breath holding. Do not hold your breath. Breathe out during the stretch and keep your breathing steady. Third mistake, locking the elbow. Keep it soft. A locked elbow sends a tense signal up the limb. Fourth mistake, forgetting the thumb. Include it in the open palm and the gentle pull. Fifth mistake, rushing through cycles. Slow, deliberate timing is the therapeutic element. Sixth mistake, inconsistency. Doing this once in a blue moon won't build the steady brain health effects we aim for. Aim for daily practice. Safety notes you need to hear. This routine is an adjunct. It supports daily well-being, but it is not a substitute for medical care. If you have severe peripheral neuropathy, recent hand or wrist surgery, significant arthritis that causes pain with these movements, unstable cardiovascular conditions, severe arrhythmias, or you're uncertain whether you should try this, check with your clinician before starting. If during the stretch you experience severe dizziness, fainting, chest pain, or sudden severe shortness of breath, stop and seek immediate medical attention. Also, do not use this routine as a reason to change or stop blood pressure medications without talking to your prescribing clinician. What can you reasonably expect? In clinical experience and in some research, gentle hand maneuvers and palm-based interventions have been associated with reductions in systolic blood pressure and with calming of the nervous system. One study cited in older adult research, reported in the context of the 2020 work by the Japanese Society of Hypertension, observed average systolic reductions in the range of about 8 to 12 millimeters of mercury in older participants. That gives us reason to believe this approach can influence blood pressure in some people, but individual results vary widely. Think of it as a helpful, low-risk tool that can support better brain perfusion and a calmer state rather than a guaranteed fix. Let's come back to the brain health connection. Better microcirculation and reduced vascular resistance mean the brain receives blood more smoothly. That helps oxygen and nutrients reach small regions of the brain that support attention, memory, and mood. A calmer parasympathetic response lowers the body's stress signaling, which in turn reduces the small spikes and dips in blood pressure and heart rate that can make thinking feel cloudy. Over weeks and months, a daily habit that improves these small factors can lead to more consistent sleep, less anxiety, and steadier cognition, the very benefits seniors often seek. I want to share one practical example to illustrate real-life change. One woman told me she began doing the routine morning and evening for 2 months. She didn't stop her medications. She took no other big changes. She noticed within a few days a small drop in the sense of anxiety when she woke up. Within a few weeks, she slept through parts of the night she used to wake from. Her concentration during the day felt more even. These are anecdotal reports, meaning they come from individuals and not from a controlled trial, but they point to meaningful everyday effects that matter: feeling calmer, sleeping better, thinking more clearly. If you have questions about how this fits with your medical plan, bring it up with your clinician. Ask whether mild hand stretches are appropriate for you and whether this routine can safely be part of your daily self-care. For those with pacemakers, unstable angina, recent cardiac events, or severe autonomic dysfunction, a clinician can guide whether and how to use such interventions. Before we finish, let's repeat the guided routine slowly once more so you can follow along now. Sit comfortably. Right arm forward, elbow soft. Palm facing out like a gentle stop. Spread your fingers wide. Fingers relaxed, thumb included. Hold that open palm for a slow 5 counts. Breathe out as you hold. Now use your left hand to gently pull the fingers of the right hand back toward the wrist. 3 counts, breathe out. Release and make a loose fist for 3 counts. Open the palm again. Repeat that cycle 6 to 8 times. When you switch to the left hand, do the same. Open palm, 5 counts. Gentle pull, 3 counts. Loose fist, 3 counts. Open palm. Slow and steady. If you want a simple cue to remember, open, pull, rest. 5, 3, 3. Open, pull, rest. That's 1 cycle. 6 to 8 cycles per hand, about 1 minute per hand. Morning, late afternoon, evening, about 4 minutes a day. You may experiment a little. Some people like to do the routine while sitting at a window and watching the sunlight on their hands. Others prefer to do it in bed with the morning light coming in. I encourage you to pair it with a routine you already have so it stays consistent. As you practice over days and weeks, pay attention to how you feel. Notice small signs: warmth in the hand, shoulders dropping, breathing slowing, sleep improving, or clearer thinking at certain times of day. Keep a simple note on a calendar if that helps. If something feels off, increasing pain, numbness, or any concerning symptom, stop and speak with your clinician. A word about realistic expectations. This is a low-cost, low-risk habit that can support brain health through better blood flow and a calmer nervous system. It may help some people reduce blood pressure modestly, and it often helps people feel calmer immediately. It does not reverse chronic disease on its own, and it should not replace prescribed medications or medical follow-up. Think of it as a helpful daily practice that increases your sense of control and supports brain perfusion. To recap, start with a brief opening stretch. Open palm for 5 seconds. Gentle finger pull 3 seconds. Loose fist 3 seconds. Repeat 6 to 8 cycles per hand, about 1 minute per hand. Do it 3 times a day, upon waking, in the late afternoon, and before bed. Move slowly. Breathe out during the stretch. Keep the elbow soft, include the thumb, and stop if you feel pain or alarming symptoms. Check with your clinician if you have recent surgeries, severe neuropathy, unstable cardiac conditions, or any concerns. Try this routine now, or add it to your morning and evening rituals. If you begin practicing it, come back and tell us how it felt in the comments. Share whether you noticed warmth in your hands, a drop in shoulder tension, or better sleep. And before making any changes to your medication or major health plan, talk with your clinician. Small, consistent habits can add up. A minute here and a minute there can help your brain get steadier blood flow and your nervous system a softer set point. It won't cure everything, but it can help you feel more in control and calmer day to day. If this was helpful, please try the routine and share your experience. For more simple, research-informed routines that support brain and heart health, subscribe and come back for the next short practice. Take care, be gentle with your hands, and check in with your doctor about what's right for you.